Joining us here in Studio 57 to take a closer look at this is Dr. Sue Varma. She is a psychiatrist and, by the way, the author of this new book, Practical Optimism. Thanks so much for being here.
Thank you for having me. Thank you.
I want to start with asking you about the use of antidepressants and the numbers that we have, because we know that it's gone up 64% in boys and girls since the pandemic started. But when we look at the numbers just for teenage girls, it's much higher, up 130%. That is just so shocking to me. Explain why.
Yes. So the numbers in teen girls was already on the rise before the pandemic, but definitely the rise is that much greater during the pandemic. And the question is, like, always twofold. When you see a rise in dispensing of antidepressants, you think to yourself, A, has the prevalence gone up? Are we seeing more mental health symptoms in the population?
Right.
Yes. But B, the receipt is the fact that these people are willing to accept treatment, and that is always reassuring. So it is not reassuring to know that symptoms have gone up, that the rate of hospitalizations have gone up in teen girls. We saw a 51% rise in emergency room visits, specifically in females. And then the question is, why are we seeing this discrepancy between the boys and girls? And is it that boys' antidepressant rates are going down because they have less symptoms? And that's actually not the case. They have symptoms, but perhaps that they're not getting treated and their symptoms aren't getting picked up as much as the girls are.
You know, this may be sort of a larger macro question, Dr. Varma, but why are we such a pill-popping nation? I've lived in Britain, in Nigeria, in France, and in all of those countries, doctors are not as quick to prescribe medication for illnesses that can be treated in other ways without using pharmaceuticals. Why is it that we see this happening even a young age now? For teenagers, they're getting prescriptions. So the question is, how concerned should parents be? How concerned should we be?
Yes. So excellent question. And I'm a big believer in a comprehensive, holistic approach to mental illness and mental wellness. And the idea that there's so many powerful, free lifestyle interventions, from meditation, yoga, social support. I call them the 4 M's of mental health: mindfulness, mastery, meaningful engagement, and movement. And we're not really pushing that enough. And when you see the rise of antidepressant use in young girls and just the symptoms, we are seeing increased social media use, right? So teens are almost on using screen time all day, but it's not the screens per se. It's the fact that key things are happening. They're not getting as much sleep as a result. They're not getting as much movement, and they're not getting as much in-person connection. And these are all things that are not related to pills. So while medication is one very important of a comprehensive treatment, it's not the be-all and end-all. What we were finding during the pandemic is that a lot of people who couldn't get to see therapists, right? Because therapy is also really key, the talk therapy portion. There's long wait lists. We don't have access to therapy. So they were turning to medications as a way of helping, which the medications can be life-saving and life-changing, but you have to make these lifestyle interventions as well, because otherwise, once you get off the medication, the symptoms can often return.
Right.
And we're also seeing a loneliness crisis in young people throughout the generations. And that is a big reason we're also seeing a lot more depression than typical.
I think to Vlad's point, I was thinking about other countries that often do have that sort of holistic approach to problems like this. I'm wondering, as a parent, how do you know if the yoga, meditation, all of those other practices are enough?
Yes.
When is the right time to introduce medication?
Yes. So what's really important that the pediatrician's visit also include a mental health screening, and now it has become mandatory to screen for depression and anxiety. And in that visit, asking questions like, are you getting pleasure from the things that you once used to? How are the grades? How is the social life? How is the sports? Like, getting a snapshot of all of that, and then being able to say, listen, for the doctor to just be very honest, to say, listen, we need to keep an eye on this. If the grooming has down in your kid, if they're talking about thoughts of not wanting to live, feeling like they don't belong, feeling like they don't matter, in my mind, that sort of escalates the urgency of getting them connected very quickly to treatment. And even if that treatment means following up with the pediatrician in a few weeks and getting them connected to therapists. But the minute a child says, I'm a burden, what is my point in life? To me, that is escalating to the point of like medical emergency. Again, medications are not the be-all and end-all. You're going to need close follow-up. You're going to need, like, it really does take a village to raise a family, not just a child, the parents included. But therapy has to be an important part of this, and also prevention. And I talk a lot about this in my book, Practical Optimism, is having a very holistic approach, but very tangible, concrete, that doesn't wait for the other shoe to drop. That's what I'm afraid of, is we wait too long, too often.
Before we go, Sue, real quick, and just yes or no, I mean, we grew up on television. We were weaned on television. People thought that was going to rot our brains. We're okay. Is television, can you equate television growing up as Gen X, even baby boomers, to what screen time is for children today, or no comparison?
No comparison. Whole different level.
Okay, that's scary. Dr. Sue Varma, thank you very much for coming.
Thank
As
you.
always, your new book is called Practical Optimism. It is awesome. We've already read it because you were on CBS Mornings earlier last week, so I hope everybody picks it up.